Welcome to Eastern Melbourne PHN's Primary Care Discovery series of videos, brought to you by the Digital Health team. We hope you enjoy this video. To keep up to date with our latest videos, hit the subscribe button and select all notifications. And if you like the video, give it a thumbs up.
Today I'm just going to be covering off quickly the WALRUS tool. Quick show of hands, who's using WALRUS in their clinic? We shouldn't ask this because I might have put people on the spot, but okay, great. So look, one of the things that we heard a lot of in the space when we were sort of, I guess, a lot younger is people loved the top bar tool. And in the switch across to Polar instead of pen, they were looking for something similar in the space. So WALRUS is our take on it. It's a little bit different. It's not quite the same thing, but it is quite useful in the, I guess, especially in the face-to-face GP space. So clinicians can actually use that while they're sitting with a patient in order to, I guess, look at some information about that patient record. So what is it? It's a precise point-of-care tool designed for GPs. We are looking at a receptionist or admin type version as well, but we came across a blocker that it doesn't quite, the admin software doesn't quite work the same way, so we're just looking at that at the moment. But it works by actively identifying items for a patient record. So that can be missing clinical or demographic information, things like risk or clinical factors, so their absolute CVD risk of developing a cardiovascular condition, some of the PIP-QI and the MBS measures as well. So it's quite useful. It's a fairly small, so it doesn't take up a lot of screen real estate. It's fairly small and just updates as a new patient record is open. So it's very useful at that point of care. It's easy to set up, I will say, with the exclusion of very certain, so Diego is our support manager, she knows all about this, but with the exclusion of some very, very, very specific IT setups, but we're always here to help. But it's very easy and very quick to set up. It does need to be installed on each GP's computer, so that is a little bit different to our other system, but you can be up and running in a minute and a half if need be. What I am here to really talk about, though, is not just what WALRUS is, but more specifically how to configure it. So it is highly customizable. Very specifically, it has a number of functions. What's the laser pointer? So this is just a quick view. So that's the actual WALRUS tool itself. So we have on there the patient name and date of birth, just so you can make sure that you're seeing the right patient there. That's just a pure safety measure. It actually will tell you that it's not the same patient if they don't match what's on your screen, so that's good to know. But as you can see down at the bottom here, it actually then gives you a bunch of notifications. So this patient has never had a blood pressure recorded, they don't have a BMI recorded, they are at risk of developing a CVD condition in the next 5 years, they obviously have diabetes and their HbA1cs are out of date, and so on and so forth. So those are all generated daily. So whenever a patient comes in, it will be as of their patient record at the start of that consultation. As long as as soon as something new gets added, it might change, but it will be the next day that it'll come through. So it's a very useful tool in that respect, but more specifically, it is customizable, where we actually can turn off some of these conditions. So, for example, a GP might not be that interested in the they're all interesting. I'm looking for one that doesn't. I should have brought up the MBS page. They may not be interested in some of the PIP-QI measures, for example, so they might want to turn those off because they generally are hitting those targets as they're actually taking care of the patient. So there is a way to actually, I feel like I'm fading in and out, this microphone's awfully sensitive. So there is actually a way to set up those permissions at both the user and a sort of practice role level, and that can be done through the Polar interface. So I'm assuming most people here are probably going to be the practice admin for Polar in the clinic. So as a practice admin, you're able to actually set those permissions for the users. They can then refine those permissions themselves, but you can actually set at the higher level, what they should have access to, and then they can further reduce that down to what they actually want access to. So there are a couple of levels there. So the first is the WALRUS sections now. That's these buttons here. So essentially, unticking one of those boxes will remove the button completely from their WALRUS, so you can get it down to just one big button if that's all they want. They will just have one big button, which might be the MBS side of things, or they can have all of those ticked in there so they'll all appear as they go in. But they can remove the graphing, the patient summary, and the timeline, etc. if they don't find any use of those, or they just generally don't want to be using them as part of the day-to-day. In order to be able to change those permissions, you'll need to jump into your management screen, into the groups and users. So it can be set to 2 levels. Now, last year, this year, geez, time's gone with COVID. The roles, that was last year. I could have sworn it was like a couple of months ago. So last year we released roles-based permissions. So you might be a practice manager, you might be an admin staff member, you might be a practice nurse, a GP, and we also have default and admin, which are POLA-specific roles. Those can actually let you set permissions at a role-based level. So you might not want your admin staff to be looking at the MBS items or the clinical risk factors for patients. So you can actually disable those against those particular users. You can as well, under that, you can, if you've got one particular staff member who might be an admin person, but they specifically look at MBS management, you may want to tick those back in. You can then override those role permissions, but that's a specific process that you'll be going through. So just on the left-hand side there, you can see I've selected, awfully small, but you have to believe me, I've selected doctor here. I've got WALRUS notifications here, and I've got each one that I want a doctor role to have access to ticked in that box, so they can actually then see whatever those permissions are. As long as the patient has that notification, they can then see that particular WALRUS notification when they're going to WALRUS. Going further in, if I want to then change, this account here has POLA admin default and doctor associated with it. So it will be the combination of those 3 roles will tell what they have access to. But I can actually then also at that user level set custom permissions as well to be able to give them access to things that the role otherwise doesn't have access to, or I might even take away something that role has access to because I don't want them to see that. So those are 2 different ways that you can approach that. The roles is really the nice quick way to roll things out, because if you're just having everyone associated as a doctor, you can set that with those doctor permissions, but you can then reduce it down further. A little confusing because, as I said, there's not really an admin view of the world at the moment. You need to be using the clinical record in order for that to function, so do keep that in mind, but that will be future-proofing against when we roll out the admin side of things. So look, just a couple of tips when using WALRUS. So what we do here probably very frequently is WALRUS is not opening, it's disappeared, I don't know where it's gone. When you actually click the big X button here, the big X button there, it will actually minimise to the system tray, which is that little area in the bottom right hand of Windows where the clock is. So if it isn't popping up on your screen, you need to go down there and actually see if you can see a little WALRUS icon in that little chevron there, and you can actually reopen it that way. One great tip is you can also pin it to your start bar. So if you search for it in your Windows menu, right click on it and you can do pin to start, it will always appear in that bottom left area there with the WALRUS icon, potentially in the middle if you're using Windows 11, which will allow you then to also very quickly open that. However, you can also set it to automatically open on Windows. So when the clinician logs into the system, Windows will automatically run that software and remember their username. It won't remember the password, they still need to enter that in, but it will remember that they would like that to open on startup and their username, and they can just type their password in and off they go. So that's really what we've got for the management side of WALRUS at the moment. I think, do we have time for questions?
Yeah, for sure.
I think we do. Does anyone have any questions around WALRUS? Because we do know that this has been something we'd like to see more use of. So I'm very questioning of whether or not there's any specific blockers anyone has with WALRUS, or if there's anything that they'd like to see in a WALRUS environment at all. So if you do have any comments, please do feel free to either come over in between the sessions, or you can actually go and pop it into the box at the back of the room. Great. Any questions?
Just to note this walkthroughs.
Thank you. Yes, I'm sorry. I did remember until I stepped up here. There is, the PHS kindly provided some walkthroughs on actually this process of setting up the user permissions up the back of the room. So feel free to go over and have a look at those and take it back. Each user will need a login. Other than that, it's fairly straightforward to do the installation from there.
If you found this video helpful, remember to subscribe to the MFin YouTube channel and give the video a thumbs up. See you in the next video.